Hi, welcome to our channel of IGNOU Audiobooks, Indira Gandhi National Open University School of Social Work, SOSW. Certificate in HIV Family Education, CAFE. BFEE-104 Communication and Counselling in HIV. Block-1 Basics of Communication. Unit 6 Health Communication, Scope and Challenges. 6.0 Objectives. On completion of this unit, you should be able to explain health communication and its function, describe different models of health communication, explain scope of health communication, and understand the challenges and addressing the concern of health communication. 6.1 Introduction. International Communication Association officially recognized health communication in 1975. In 1997, the American Public Health Association categorized health communication as a discipline of public health education and health promotion. Communication is essential to successful public health practice at every level: intrapersonal, interpersonal, group, organizational, and societal. There must be careful deliberation concerning the appropriate channel for messages to best reach the target audience, ranging from face-to-face interactions to television, internet, and other forms of mass media. Thus, communication is more than mere exchange of information. 6.2 What is health communication? Health communication is the study and use of communication strategies to inform and influence people to make choices about their health. Messages are spread through different channels such as mass media, print materials, social media, and face-to-face conversations. According to Healthy People 2010 guidelines, health communication encompasses the study and use of communication strategies to inform and influence individual and community decisions that enhance health. It links the domains of communication and health. Health communication encompasses the study and use of communication strategies to inform and influence individual and community knowledge, attitudes and practices, KP, with regard to health and healthcare. There is interface between communication and health which is increasingly recognized as a necessary element for improving both personal and public health. Health communication is often used synonymously with health education, which can contribute to all aspects of disease prevention and health promotion. The most obvious application of health communication has been in these areas of health promotion and disease prevention. There has been improvement of interpersonal and group interactions in hospitals and other clinical situations, such as between provider and patient, provider and among members of a healthcare team, through the training of health professionals and patients in effective communication skills. Thus, health messages through public education campaigns can help in changing the social climate in order to encourage healthy behaviors, create awareness, change attitudes, and motivate individuals to adopt recommended behaviors. Health communication has become an accepted tool for promoting public health. Health communication principles are often used today for various disease prevention and control strategies, including advocacy for health issues, marketing health plans and products, educating patients about medical care or treatment choices, and educating consumers about healthcare quality issues. U.S. Office of Disease Prevention and Promotion, 2004. At the same time, the availability of new technologies and computer-based media is expanding access to health information and effective use of these new tools. 6.3 Functions of health communication. 1. Information. The main function of health communication is to provide scientific knowledge or information to people about health problems and how to maintain and promote health. Thus, information should be easily accessible to the people so that we can Remove or eliminate social and psychological barriers of ignorance, prejudice, and misconceptions people may have about health matters. Increase awareness of the people to the point that they are able to perceive their health needs and influence people to the extent that unfelt needs become felt needs and felt needs become demands. Park, 2015. It will help in refuting myths and misconceptions. 2. Education. Education plays a very important role in prevention-oriented approach to health and disease problems, and the basis of all education is communication. Health. Education can bring about changes in lifestyles and risk factors of disease. It can help to increase knowledge and to reinforce desired behavior patterns. It can also increase knowledge and awareness of a health issue, problem, or solution, which influence perceptions, beliefs, attitudes, and social norms. According to Almata Declaration, 1978 has given the concept of health education that health education is promotion of healthy lifestyles, modification of social environment in which the individual lives, community involvement, promotion of individual and community self-reliance. The main aims and objectives of health education are stated below. A. To encourage people to adopt and sustain health-promoting lifestyles and practices. B. To promote the proper use of health services available to them. C. To arouse interest, provide new knowledge, improve skills and change attitudes in making rational decisions to solve their own problems, and D. To stimulate individual and community self-reliance and participation. To achieve health development through individual and community involvement at every step from identifying problems to solving them. It is clear that education is necessary, but education alone is not sufficient. Thus, healthcare providers need to play important roles. They are provide opportunities for people to learn how to identify and analyze health and health-related problems, and how to set their own targets and priorities. Make health and health-related information easily accessible to the community. To indicate to the people alternative solutions for solving the health and health-related problems they have identified, and people must have access to proven preventive measures. Park, 2015. 3. Motivation. One of the goals of health communication is to motivate individuals so that they can apply the health information into personal behavior and lifestyle, which will bring the benefit of behavior change for their own health. Motivation includes the stages of interest, evaluation, decision-making, etc. for proper success of program implementation at individuals and society at large. Motivation assists in passing from the stage of awareness and interest to the final stage of decision-making and adoption of the new ideas. 4. Persuasion. Persuasion is a conscious attempt by one individual to change or influence the general benefits, understanding, values and behavior of another individual or group of individuals in some desired way. Park, 2015. It can change lifestyle as it is employed deliberately to manipulate feelings, attitudes, and beliefs. It is also a kind of force that reinforces knowledge, attitudes, and behavior. 5. Counseling. Counseling relies heavily on communication and relationship skills. Counseling is the service offered to the individual who is undergoing a problem and needs professional help to overcome it. Therefore, counseling is a process that can help people understand better and deal with their problems and communicate better with those with whom they are emotionally involved. It can improve and reinforce motivation to change behavior and helps to reduce or solve problems. Thus, counseling needs an expert as a counselor to extend assistance to a needy person. Therefore, a counselor should be able to communicate information properly, To gain the trust of the people, to listen sympathetically to people who are in distress, to understand other persons' feelings and to respond to them in such a way that the other person can feel free to express his/her feelings and to help people reduce or resolve their problems. 6. Health development and organization. Communication can play a powerful role in health development by helping to diffuse knowledge in respect of the goals of development and preparing the people for the roles expected of them. Further, communication is an important dimension of health organization. It is a means of intra- and intersectoral coordination. There are vertical communications which can be downward or upward that include top administrator to the beneficiaries, and horizontal or cross communications which takes place usually between equals at any level. 6.4 Models of health communication. Health communication can take place through different models. They are: 1. Medical model. The medical model is primarily relied on the recognition and treatment of disease and technological advances to facilitate the process. The emphasis is on dissemination of health information based on scientific facts, but the medical model did not bridge the gap between knowledge and behavior, as there is little or no intervention on social, cultural, and psychological factors. 2. Motivational model. Motivation acts as the main force to translate health information into desired health action. But it needs a long procedure to convince an individual, groups, and society at large. Motivation includes the stages of interest, evaluation, and decision-making. Initially, individual has to go through awareness or getting information about the subject. If he is interested, he will seek more detailed information about the subject. Then he will evaluate the various aspects of the information received, and later decision-making will be done based on the evaluation whether he accepts or rejects the information. Sometimes the mentioned stages are not necessarily rigid. There may be skipping of stages depending on the adoption process of individuals, groups, and society. Thus, effective communication strategy should be evolved to help the individual in passing from one stage to another. 3. Social intervention model. The motivation model ignored the fact that in a number of situations, it is not the individual who needs to be changed but the social environment which shapes the behavior of individual and the community. Thus, there is an importance of group or social support in helping reaching the decisions and taking action. Therefore, an effective health communication is based on precise knowledge of human ecology and understanding of the interaction between the cultural, biological, physical, and social environmental factors. 6.5 Scope of health communication. 1. The individual. The individual is the most fundamental target for health-related change, since it is individual behaviors that affect health status. Communication can affect the individual's awareness, knowledge, attitudes, self-efficacy, and skills for behavior change. Activity at all other levels ultimately aims to affect and support individual change. 2. The social network. An individual's relationships and the groups to which an individual belongs can have a significant impact on his or her health. Health communication programs can work to shape the information a group receives and may attempt to change communication patterns or content. Opinion leaders within a network are often a point of entry for health programs. 3. The organization. Organizations include formal groups with a defined structure, such as associations, clubs, and civic groups, worksites, schools, primary healthcare settings, and retailers. Organizations can carry health messages to their membership, provide support for individual efforts, and make policy changes that enable individual Change. 4. The community. The collective well-being of communities can be fostered by creating structures and policies that support healthy lifestyles and by reducing or eliminating hazards in social and physical environments. Community-level initiatives are planned and led by organizations and institutions that can influence health, schools, worksites, healthcare settings, community groups, and government agencies. 5. The society. Society as a whole has many influences on individual behavior, including norms and values, attitudes and opinions, laws and policies, and the physical, economic, cultural, and information environments. Clearly, the more levels a communication program can influence, the greater the likelihood of creating and sustaining the desired change. Health communication alone, however, cannot change systemic problems related to health, such as poverty, environmental degradation, or lack of access to health care, but comprehensive health communication programs should include a systematic exploration of all the factors that contribute to health and the strategies that could be used to influence these factors. 6.6 Challenges of Health Communication. Health communication faces many challenges. While problems can be attributed to many factors, some of the most challenging issues are discussed below. 1. One of the most pertinent challenges health communication faces is the general gap that has formed between the population's health literacy and the use of health communication. There are instances that professionals' use of unexplained medical jargon, ill-formed messages, that lead to create a general educational gap. It is also seen that even the mass have difficulty understanding written health materials, understanding health care and policies, and generally do not comprehend medical jargon. Such shortfallings of health communication may lead to increased hospitalizations, the inability to respond to and manage a disease or medical condition, and a generally declining health status. 2. Mass communication is used to promote beneficial changes in behavior among members of populations. A major criticism of the use of mass media as a method of health communication is large amounts of information that may be misleading, inaccurate, or inappropriate, which may put consumers at unnecessary risk. This issue may generate unwarranted panic amongst those customers. 1 is related to the risks associated with consumers' use of poor quality health information to make decisions. These concerns are driving many people to distrust health services which have caused an immediate public health concern. 3. A one-dimensional approach to health promotion or other single-component communication activities has been shown to be insufficient to achieve program goals. Thus, for making a successful health promotion program, multidimensional interventions such as community-based programs, policy changes, and improvements in services and the health delivery system has to be planned to reach diverse audiences. An important factor in the design of multidimensional programs is to allot sufficient time for planning, implementation, and evaluation to support the elements of the program. Public-private partnerships and collaborations can leverage resources to strengthen the impact of multidimensional efforts. 4. Communication occurs in a variety of contexts, for example, school, home, and work, through a variety of channels, for example, interpersonal, small group, organizational, community, and mass media, with a variety of messages, and for a variety of reasons. In such an environment, people do not pay attention to all communications they receive but selectively attend to and purposefully seek out information. Freemuth et al., 1989. One of the main challenges in the design of effective health communication programs is to identify the optimal contexts, channels, content, and reasons that will motivate people to pay attention to and use health information. 5. The environment for communicating about health has changed significantly. The dramatic increases in the number of communication channels and the number of health issues vying for public attention, as well as consumer demands for more and better quality health information, and the increased sophistication of marketing and sales techniques over the internet. People have more opportunities to select information based on their personal interests and preferences. 6. Limitations of printed materials in different languages lead to affect the health communication. Direct translation of health information or health promotion materials should be avoided. For different social, cultural, ethnic populations who have different languages and sources of information, it is required to adopt audience-centered perspective for effective health promotion and communication. In these cases, public education campaigns must be conceptualized and developed by individuals with specific knowledge of the cultural characteristics, media habits, and language preferences of intended audiences. Television and radio serving specific ethnic populations can be effective means to deliver health messages when care is taken to account for the language, culture, and socio-economic situations of intended audiences. Thus, an audience-centered perspective also reflects the realities of people's everyday lives and their current practices, attitudes and beliefs, and lifestyles. Some specific audience characteristics that are relevant include gender, age, education and income levels, ethnicity, sexual orientation, cultural beliefs and values, primary languages, and physical and mental functioning. 7. Generalizing the program policy and generalizing the health information to the mass will limit the audience from health communications. It is therefore required to target specific segments of a population and tailoring messages for individual use to make health promotion activities relevant to audiences. Examples: adolescents at increased risk of smoking, etc. 8. The other challenge is related to the protection of privacy and confidentiality of personal health information. It is so happened that the personal privacy and the confidentiality of health information of consumers are magnified when information is collected, stored, and made available online. In the near future, personal health information will be collected during both clinical and non-clinical encounters in disparate settings, such as schools, mobile clinics, public places, and homes, and will be made available, so it is required to have policies and procedures to protect privacy and to ensure confidentiality. 9. Even with access to information and services, however, disparities may still exist because of many factors such as illiteracy, lack health literacy, levels of knowledge and understanding, customs, beliefs, religion, attitudes and social class differences. Health literacy is increasingly vital to help people navigate a complex health system and better manage their own health. Differences in the ability to read and understand materials related to personal health as well as navigate the health system appear to contribute to health disparities. Well-designed health communication activities can help individuals better understand their own and their community's needs so that they can take appropriate actions to maximize health. 10. Health communication alone, however, cannot change systemic problems related to health, such as poverty, environmental degradation, or lack of access to health care, but comprehensive health communication programs should include a systematic exploration of all the factors that contribute to health and the strategies that could be used to influence these factors. Well-designed health communication. Activities help individuals better understand their own and their community's needs, so that they can take appropriate actions to maximize health. 6.7 Summary. Health communication is rarely used as an independent strategy in community health because knowledge is not enough to improve the health of a community. Instead, health communication is an integral part of all health promotion strategies. You have also understood the different functions and models of health communication. You also have got an insight of barriers and challenges of health communication, where campaign messages needed to reach and influence target audiences. You need to develop strategies from the audience perspective for effective strategic health communication interventions. Thank you.